Welcome to the weekly checkup on ReachMD for the week of November 2nd, 2015. This week's news segment examines a relatively unknown health issue that may be sweeping America. By now, the subject of antibiotic stewardship has become front and center to many health centers nationwide. But a recent study from Johns Hopkins Bloomberg School of Public Health reveals that the consequences of antibiotic overuse may extend beyond multi-drug resistant infections. Researchers are claiming it may also lead to significant weight gain and obesity issues later in life. The study utilized health records from over 160,000 children over a 10-year period, finding that antibiotic use was associated with changes in body mass index over time. The researchers are investigating this correlation further to better understand the complex systems causing childhood obesity. In continuing coverage of children's health, ReachMD launches this month's Focus on Diabetes with a segment devoted to management of type 1 diabetes in young children. Join endocrinologist experts as they examine how pediatric physicians can take better care of their most impressionable diabetic patients. And now for a quick look at some of our latest featured content. In the United States, it's estimated that 230,000 women will be diagnosed with breast cancer this year alone. New recommendations for mammogram screening in women with average breast cancer risk have emerged from the Journal of the American Medical Association. In this week's JAMA report, get the updated guidelines for your patients. For more featured content, head to ReachMD.com or listen in on iHeartRadio or tune in. For this week's video highlight, we bring you to the floors of the American College of Emergency Physicians annual meeting in Boston. Dr. Matt Bernholtz has the on-site observations and updates with innovations being presented by experts in the field.
Hi everyone, this is Dr. Matt Bernholtz, and in this game that I perpetually find myself playing of Where is Dr. Matt, I appear to be in Boston, Massachusetts this week for the American College of Emergency Physicians annual meeting. And it has been a fun ride. Emergency physicians are extremely fun to talk to. They're always on the go, always doing cutting-edge stuff. I've had the chance to talk to a physician who runs the research forum here, where they are doing some really, really interesting stuff, including highlights such as learning how to tweet at live events at massive venues so that they can pick up important health data from people as it's happening and be able to monitor what's going on and be able to help people and intervene as needed. There are physicians here who are working on completely updating, revising resuscitation guidelines. One physician in particular I got the chance to speak to, doing a great job in that respect, and has set up whole teams to be able to identify how they can better improve that. I've talked with people who have changed the scope of health policy issues for emergency medicine. The list goes on and on and on. But suffice to say, check it out. Look into it online. Some really, really cool things happening out here. And I hope to see some of you soon.
For those of you in the Chicago area, be sure to mark your calendars for this Friday, November 6th. Omnia Education's Women's Health Annual Visit Conference is coming to the Windy City at the Sheraton Chicago Hotel and Towers. Come visit the ReachMD booth to learn more about our available programs and maybe even join us on the air. If you're not able to make it to Chicago, don't sweat it. Registration for Omnia Education's Stages in Women's Health Conference is still open. The program will be held in New York City on Saturday, December 4th and 5th at the New York Marriott Marquis. Until then, I'm Marshall Miller, as always, inviting you to be part of the knowledge.